supplements, and what to watch for during recovery. I'm here. If you guys have questions, raise your hand, drop them in the comments. We'll take those at the end of the time. We won't be interrupting, we'll be taking those at the end of time. So, we're going to talk about practical ways to support healing, promote milk production, and recognize when something's just not right, helping you give moms and babies the best start possible. We're going to walk you guys through practical steps to support the important projects that mom is doing, right? Milk, all the good stuff. Going to help our breeders and our pet professionals confidently manage postpartum care and give moms and babies the best start possible. BOLO, you guys, be on the lookout. There is an exclusive webinar coupon code. The code is E as in Edward, D as in dog, U as in umbrella, 15. This will give you $15 off orders of $199 or more. This is a one-time use only coupon. Marty, let's hit it.
Great. So this is also an opportunity for the one we're doing next month. That'll be on December 10th. I think probably in the evening. We're still establishing that, but there is the QR code. You can go ahead and sign up. And at that one, we're going to talk about sending puppies to their new homes. It seems like a pretty timely thing to do just before the holidays, because there are a fair number of people that do like to have new puppies at holiday time. So we'll be covering that as well. So tonight, we just have the very simple healthy pregnancy, healthy postpartum period, preparation, and a few other things about postpartum complications. So our primary focus is going to be on postpartum complications, meaning retained puppies, retained placentas and metritis, mastitis, agalactia, aggression of the dam, eclampsia, diarrhea, poor appetite, SIPS, and anything else that can make a dog sick. So we have this as our primary focus. But what I want people to really think about is something that Laura started with, and that's starting with a healthy pregnancy. You can't just start at the time that you think she's ready to have her puppies. You need to start well before the time that you breed her. You need to get her vaccines taken care of ahead of time. You need to make sure that she's been tested for heartworm disease, for the tick-borne diseases, because in a lot of states on the East Coast and in the Midwest, we see a lot of tick-borne diseases, and these dogs can become very, very sick during pregnancy if we don't adequately diagnose and manage those before the breeding. Remember, pregnancy is an immunocompromised state. So if she was walking around doing okay with her tick-borne disease, but then the pregnancy affected her immune system, that can change things. Don't forget to test for brucellosis, and there's currently no USDA approved brucella test for in-office use. So it's going to require that your veterinarian send samples out to a diagnostic lab to get a USDA approved test. So plan ahead, do those tests before the progesterone, before you're ready to breed. And then you want to make sure that you have done a comprehensive physical examination with your veterinarian. We do vaginal exams to make sure that the female is roomy enough to have her puppies. We check for hernias, umbilical and inguinal. We check for heart murmurs. We check for any other of the health screening things. We check mammary glands to make sure that there's not a mammary tumor. In some of our older dogs, they may already have mammary tumors by the time we're ending their breeding career. So have all those physical exam pieces taken care of prior to the time that you breed. Have her rabies given ahead of time. All those things so that during the pregnancy, we don't have to worry about any of that or in the immediate postpartum period. Now, you may say, how do I find a veterinarian that is going to be able to do these things for me? And the answer is therio.org. Theriogenology is a made up word by veterinarians to reflect the care of a pregnant animal. So that could be a horse, a cow, a goat, a sheep. Obviously, chickens don't get pregnant, they have eggs. So anybody that's doing any kind of reproductive work, Therio.org has this great webpage on it called Find a Vet. If you go to that, and then you can put in your species requirements, so you can put in, if you're looking at dogs, you can put in which procedures that you're looking for them to do: TCI, C-sections, progesterone testing, speaking at your local breed club, and then your zip code. And it's going to automatically then pull up a very short list of veterinarians in your area that do these procedures on the species that you're looking at. So instead of struggling to try and find somebody that does reproduction, make sure that you use this tool on the therio.org website. All right. Secondly, we need to talk really heavily about nutrition. If we don't feed the machine, whether it's the male machine or the female machine, if we don't feed the machine adequately, the dog is not going to be able to reproduce. She needs to have an adequate diet, a more than adequate diet for her pregnancy. There is only one pregnancy diet on the market, and that's made by Royal Canin. That's the HT42D dog food. If you sign up for the Crown Partners program, they will drop ship the product to you. There is no place that you can buy this product in the retail market. And it comes in two sizes, large breed and small breed. So I'm going to let you figure out if you have a large breed or a small breed. The alternative that we recommend is the Performance Diet by Purina Sport, their 30/20 diet. Those are the two diets that we recommend universally for our dogs that we're using in a breeding program because we've had very good success with those products. We desperately try to avoid raw meat during the breeding time periods and during pregnancy. I really think that raw meat has some disadvantages to it. And then, of course, we want to avoid any of the products that may have flax or peas or other proteins that may include phytoestrogens. Why do I want to avoid the raw meat diets? And that's because number one, we can see nutritional imbalances. Many times they have more calcium than they need, more phosphorus than they need, but not enough of some of the other minerals and nutrients. They may promote parasite transmission. They may promote bacterial transmission, such as salmonella. And more recently, we've started to see highly pathogenic avian influenza, HPAI, showing up in cat foods that are raw. We haven't seen them in dog foods that we're aware of yet, but avian influenza is contagious to other species besides just birds. We've seen it in people, we've seen it in cattle, and there's concerns about it in cats that have died from this. So be aware that the raw meat diets have some distinctive disadvantages during the breeding time period in your dog's life. If you want to feed it the rest of the time, you and your veterinarian can come to terms with that. But during pregnancy and lactation, I strongly recommend that you avoid those. Next is their ideal weight. We want dogs to start off somewhere between a 4 and a 6 on a scale of 1 through 9 for body condition. This scoring system helps you to see that the 1, 2s, and 3s are dogs that are underweight, the 7s, 8s, and 9s are dogs that are overweight, and both underweight dogs and overweight dogs have lower fertility. We have increased levels of hormones in the overweight dogs that's stored in the fat that can interfere with fertility, both the males and the females. And there are definitely concerns with being underweight, with not having the nutrients that they need to carry a pregnancy. So be aware of those things. Talk to your veterinarian, see if you need any help adjusting the daily intake of her food. And there's some pretty good articles out there. If you email me, I will send you the information about the overweight dogs and their lower fertility. Now, weight gain should occur during pregnancy, typically in the first 4 to 5 weeks, about the time that you ultrasound the female. We don't expect to see any weight gain, and sometimes even just a smidge of a weight loss, because around the 3rd to the 5th week, she may not eat very well. But starting at the 4th week, you can increase her daily intake by 10% a week, approximately. Now, if she's carrying a big litter, if she's carrying 14 puppies, you may want to go more than 10% a week. If she's carrying a small litter for her breed, then you may want to not increase quite as much as 10%. But the average, say, Golden Retriever, Labrador, they're going to gain about 1 to 2 pounds per puppy that they're pregnant with. So that kind of gives you a rule of thumb. If she's a Golden Retriever and she's pregnant with 10 puppies, she's going to gain 10 to 20 pounds. That helps you to kind of assess where you're at on a weight gain basis. Supplements are really important. We have a lot of good success with Be Strong, helping bring females into heat and also helping to maintain their appetite. Like I said, around the 3rd to the 5th week, a lot of dogs have sort of a morning sickness kind of syndrome, that they don't eat particularly well. That's one of the two most reliable non-medical signs of pregnancy. One is loss of appetite. Two is a clear mucousy vaginal discharge. Of course, ultrasound is always your best diagnosis, but those two things can be pretty helpful in assessing pregnancy without an ultrasound. But Be Strong does seem to help overcome some of that loss of appetite. B vitamins are an appetite stimulant, and they do help bring bitches into heat. The next supplement that we're going to recommend is going to be Oxymate. It contains iron, and all females that are pregnant, doesn't matter if you're a cow or a horse or a human or a dog, you're going to become anemic during the late stages of the pregnancy, primarily because the blood volume expands faster than the bone marrow can keep up with. So you may be chugging out new red blood cells, but not at the rate that you need to accomplish the blood volume expansion it takes to do the blood flow through the placentas. So iron is very helpful in preventing some of those anemias. Folic acid, of course, will help reduce the chances of midline defects, such as cleft palates, umbilical hernias, some of those things. Zinc is also helpful in the blood cell production. And I do want to make very clear to you, there has been some unfortunate bad press about cottonseed meal causing fertility issues. It has been electively removed from all of the Revival Breeders' Edge products. They weren't required to remove them. They did choose to do this on their own, just because of feedback from our customers. And that has all of the cottonseed meal has been replaced by pumpkin seed protein. We don't have a single product left in our warehouse that still has cottonseed meal in it. So you can with confidence order any of the products that are coming directly from Revival. I can't speak for the secondary sellers, but I can tell you all of the diets that are coming and the supplements that are coming from Revival are going to be with pumpkin seed protein as a replacement for cottonseed meal. So that's a good reason to celebrate. Next, I'm going to talk about probiotics. And probiotics, we know from a couple of years ago, that was kind of the darling of the Therio conference, and that we saw a number of papers that came out that showed a reduction in mastitis, a reduction in mastitis, metritis, and a few other disorders that were related to bacteria, GI signs like diarrhea during pregnancy. So probiotics have proven to be very helpful in reducing some of those concerns. Now, there's a lot of good ones on the market. Doc Roy's makes GI Synbiotics. They make a 25-pound box. So if you have a bunch of dogs and you're feeding a bunch of them, you have the opportunity here to say, okay, let's do some probiotics in a large scale. Royal Canin has come out recently with Boulardii as yeast, that's Boulardii, and that has some really important reproductive claims, such as the puppies are more uniform in size during the pregnancy, and the puppies respond better to the vaccinations when this is given to the mother. Yes, you give it to the mother and you get those responses from the puppies. And then we have this newer product called Nurture Flora that is designed for our neonatal puppies, obviously not pertaining to the pregnant dog, but to the neonatal puppies, we can improve their GI health by feeding them this Nurture Flora. It comes in a tube as a gel, and it does improve their GI health so that they're getting the right bacteria from birth on. All right, water, I think, is the most important nutrient, and we sometimes forget to look at it. It is a good idea if you're having fertility issues in particular that you check for nitrates and coliforms in your well water or your water around your facility. You can take these samples to the county extension agent and they will run the samples most of the time for free or a very low cost. And they can help you to determine if you have any of these contaminants. And I do encourage people to take samples from more than one location at their home, maybe from your kitchen sink, maybe from the spigot in the kennel, any place that the dogs are having access to water. So those would be important things for you to be able to test if you're having concerns about fertility or health of your puppies. Puppy count x-rays, of course, are really important for preparation for whelping. Why do we want to take them? We want to know how many puppies we're having. It helps to take the dog in fasting, and it helps her if she's had a stool before you take the x-rays. If she hasn't had a stool, you can take her out for a little bit of a walk, maybe put a match in her rectum and see if you can get her to have a stool. And if you take digital x-rays with two views, meaning one with the right side down and one with the left side down, your chances of getting an accurate puppy count are much greater than if you just take one view or one view with her on her back. This is a great example of planning ahead. This is Ruby. She had a litter of 15 puppies the day after Christmas at our practice. We were very fortunate that she raised all 15. The previous litter she had, she lost half of her litter of 6. So this took a lot of work on the owner's part and a lot of planning. So she had a planned C-section. She was taught how to tube feed. We went through all the stuff and she did a fantastic job of raising all 15 of her little puppies. I swear in this picture, Ruby can count. Okay, scheduling a C-section, we do that based on breed. So if we have French Bulldogs, Pugs, Boston Terriers, a lot of those breeds that are brachycephalics, or Bernese Mountain Dogs and Pembroke Welsh Corgis, many times we will schedule C-sections for those. It will depend on litter size. If she's having a very small litter for her breed or a very large litter for her breed, anything more than 9 puppies, we're going to recommend a scheduled C-section. And then, of course, it also depends on her history. If she's previously popped out 14 puppies successfully and now she's pregnant with 10, you'll probably be fine. If she's previously had a litter of 9 and ended up with a C-section and she's pregnant with 14, you probably should just schedule a C-section with your veterinary clinic. Of course, the next thing is going to be to have all of your supplies ready. It's really hard anymore now that we've had all the changes with COVID to get overnight delivery options for many of the products. We used to be able to go to Walmart at 2 o'clock in the morning We used to be able to order from Amazon and count on something to come the next day. And that's not always happening. We've had some definite changes with all of the different political things that have happened. So we want to make sure that you have all the supplies in advance that you need. We're open 7 days a week at our call center, but that doesn't mean that we can get shipments out on Saturday afternoon that are going to get to you on Sunday. So plan ahead so that you have all of your supplies ready. Some of these you can get through Amazon, most of them you can't. So grab your camera. This will be in the handout that we send you, but grab your camera, take a picture of this slide. These are all the supplies that you can get from Revival Animal Health that are specific to dog breeding. So Revival is your one-stop shop for all of these materials, all of these products. So it's a great place for you to get a handle on what you need to have ahead of time. We recommend, if you are going to have litters that are high risk, brachycephalics, puppies that are especially small, that you go ahead and order the puppy warmer incubator and the puppy warmer oxygen concentrator in advance so that you have this. Again, they can't get these shipped to you overnight. So you want to make sure that you have these on hand so that you have this kind of support available for your puppies should you have a crisis. The blankets and the other things that you're going to have at home are going to be things that you can order on your own. You can buy Vaseline and Eagle brand sweetened condensed milk at your local store, but a lot of these other products you may already have just hanging around the house. I typically keep all mine organized and stored together in an ice chest so that when I go to get them, they're organized, they're clean, they're replaced with fresh product. I'm ready to go. And then there's a few items that are prescription items like oxytocin and calcium gluconate, metoclopramide to bring in the milk, Dopram, that you're going to need to get from your veterinary clinic. So make sure that you've talked to your veterinarian in advance and that you have these supplies planned for so that you're not doing this at the last minute. So I don't keep the ice cream in my ice chest for weeks at a time, but I do like to pack everything up at the end of the time I have a litter, put it all into a nice organized place, have it clean, have it ready to go. And then you just need to replace a few items when you're ready to have your puppies. Labor. Here we're finally at labor. So we know that calcium and oxytocin considerably improve the quality of labor patterns and the speed at which we can deliver our puppies. So using those two products in tandem can be very helpful in having successful whelpings. If you are going to use the injectable calcium gluconate, it is a prescription product that your veterinarian can provide for you. The 10% product is what you need to buy. Do not buy the cattle product. That's 23%. That's too strong. That's going to cause chemical burns under the skin. There we have the chemical or the calcium gel, which is a very effective tool. It's absorbed very quickly through the mouth and through the GI tract, so we can get puppies on the ground pretty quickly. Then we have tablets, powder, and then we'll talk about human preparations. In regards to the speed of onset, how quickly does the calcium work? The injectable is your best bet. We always give that subcutaneously, never IV. Then we're going to use the gel. If we don't have the injectable, the gel is second fastest. So if she starts labor and you're ready to go, you start giving her calcium gel as soon as labor starts. We have seen some considerable improvements in the speed at which bitches have their puppies. My personal dog had 3 puppies in 45 minutes with a little bit of calcium gel. She started into labor about 10 o'clock at night, gave her some calcium gel, gave her a little bit more, and between midnight and 12:45, I had 3 puppies out. Second to the gel is going to be the speed of onset for powder, then is the tablets, and then Tums. I know a lot of people rely on Tums because you can get them over the counter, but they are not going to give you the labor patterns that you're going to get from the injectable, the gel, and the powders. So if you pair calcium with oxytocin, we need calcium in the system before oxytocin because it helps the calcium to bind and improve labor patterns. Now, using oxytocin should be used with great care. Calcium is pretty hard to overdose. Oxytocin, on the other hand, is very easy to give too much. So I'm very, very careful with my use of oxytocin. And Dustin has a little bit of a video here for us that's going to help explain some of the drug use of oxytocin.
When you looked in my direction, I thought my heart might explode. My heart was racing and I thought it might explode. Because my sympathetic nervous system caused norepinephrine to stimulate my sinuses. endoatrial node. When you looked in my direction, when you first looked into my eyes, when you looked into my eyes, my stress response diverted blood flow from my stomach and intestines, and it felt like butterflies. I knew that I wanted to marry ya as my ventral tegmental area sent signals to my nucleus accumbens. And oh, oh, oh my lord, the anticipation of reward, that dopamine starts pumping. I know oxytocin is the potion of devotion. Give me that dose of dopamine. Hold the serotonin still going, growing stronger all the time. I love you, and I'm never gonna change my mind. When you first smiled at me, I did foolish things. Really stupid things. Because my judgment was impaired by a reduction in activity in my amygdala and the frontal cortex of my brain. When you first smiled at me, I began to fall. One smile and I began to fall. And so did my serotonin levels, producing anxiety. I couldn't eat or sleep at all. Then a year or two went by with serotonin on the rise, till I was feeling comfortable and calm. Now every single time we touch, I get that oxytocin rush. Our bond has never been so strong. I know oxytocin is the potion of devotion. Dial back that dopamine. Here comes serotonin, still going, growing stronger all the time. I love you, and I'm never gonna change my mind.
Lady, we've been together for a while now and things are starting to mellow out. But that's okay, because we can get those sparks of dopamine back by experiencing new things together.
Oxytocin is the potion of devotion. A little bit of dopamine, a lot of serotonin, still going, growing stronger all the time. I love you, and I'm never gonna change my, never gonna change my, never gonna change my mind.
Okay. So I hope the video was useful to you in kind of understanding, why do our dogs fall in love with their puppies? Why do they stop eating? Why are they different? And of course, remember, oxytocin doesn't just cause uterine contractions. It certainly does that, but it also creates milk letdown and it improves maternal skills. So it really has a lot of aspects to it. And I think that video is just kind of an interesting way to look at it. All right, so using oxytocin can be very valuable, but there are very strict rules as far as I'm concerned. If you use oxytocin the wrong way, you can really cause some damage. I've seen uteruses rupture. I've seen puppies shrink wrapped into the uterus by using too much oxytocin, too much at a time, too many doses, too vigorously. So we use itty bitty little tiny doses. Whelpwise, Karen at Whelpwise has developed some very good skills in using oxytocin and knowing that these very tiny, these micro doses used with a TB syringe, not the 3 syringes, 3 cc syringes, but the 1 cc syringes with little tiny markings on them, can very much improve the quality of uterine contractions by using micro doses of oxytocin, not big ones. Rules are never before the first puppy is born, never if she's already in hard labor, and never if you have given more than 2 doses. You just need to move on. So if that hasn't worked, you've given calcium, you've given oxytocin, and it's not delivering puppies, you need to find a veterinarian that can do a C-section for you. All right. Now, the real topic of tonight's topics, which is the postpartum complications. So we're going to talk about retained puppies, retained placentas, metritis, mastitis, agalactia, aggression, eclampsia, diarrhea, poor appetite, and SIPS, one of my favorites. So Like we talked about before, prepartum x-rays before she has her puppies so that you know how many puppies to expect is really useful. Now, when you get up to an x-ray that has 15 puppies on it, it can be pretty difficult to get an accurate count. If that's the case, anything more than 9 or 10 puppies, if your veterinarian is having a difficult time counting, please do not put this on Facebook. It's not going to be helpful. These images degrade and they're not easy to see. They're usually pointing the wrong direction. They're usually low quality films that I see on Facebook. So please do not ask your friends. If your veterinarian can't read your x-ray, then there may be something going on. If you have more than 9 puppies, we are going to recommend a C-section. Your veterinarian may or may not buy into that. If they do, great. It doesn't matter how many puppies you have. If you're having a C-section, they'll take them all out. If, on the other hand, you're trying to figure out how many are there and it's really hard to count because there's so many, you can always go back in the day after she has the puppies or the night that she has the puppies and get another x-ray to make sure that the puppies are all gone. Ultrasound is not quite as accurate in picking up a lonely puppy that got left behind as an x-ray because it's more of a movie and not a snapshot. So it can be a little bit more tricky to use, but it's still a useful tool. The alternatives to that, a lot of people want to use Dopplers, fetal Dopplers, and you can purchase those. Whelpwise sells them. They're a nice tool, but if you have a deceased puppy, you're not going to know if the puppy's still there or not because without a heartbeat, the Doppler doesn't tell you if a puppy is present. And palpation, feeling the abdomen, is not very accurate. It's pretty easy to be fooled on that. So I suggest that you go in for some kind of imaging, x-ray, or ultrasound. If you have a retained puppy, if there's a puppy left behind and you're a few hours out, you may still be able to get her to go back into labor with calcium, oxytocin, and some injectable dextrose to improve her uterine contractions if you intervene early. If it's too late, if it's been a day or two, 3 days, and the female's starting to get sick, run a fever, isn't doing well, you may end up having to do a salvage C-section going in and just taking out the puppy, knowing that it's deceased. But after the fluid is gone from around the puppy, they tend to kind of Velcro into the uterus, especially if they're coming out back in first. So it's pretty difficult to get her to go back into labor once she's out of labor by a day or two. So here's a great example of Sloopy, this little Malamute puppy that I'm holding in my left hand. She was the owner of the dog had an x-ray taken, a prepartum x-ray taken. This was many years ago. This was probably 20 years ago. She came in, she had had an x-ray taken. She called me after hours and she said she had 8 puppies. And I said, yeah, but there were 9. And she said, no, I'm pretty sure there are only 8. She's eating, she's acting like she's done. I said, no, there's 9. And she said, are you sure? And I said, I'm sure. And she said, are you sure you're sure? I said, I'm sure. And she said, okay, fine. I guess I better come in. So she was leaving for her national the next morning and was going to leave her dog and her puppies at home with her dear husband, who is very competent. But if there had been a retained puppy left and she found out 3 or 4 days later, the female would have been pretty sick and the puppy would have been pretty deceased. So instead, she came in. We were able to deliver this puppy, and this is her. Hang On Sloopy was her name. This owner comes up with fabulous names for her dogs. This is another example of a dog that wasn't getting the kind of prenatal care we would recommend. She had had her puppies on a Wednesday. She came in on Saturday running a fever of 105 and a very deceased puppy left behind. So planning ahead to know how many puppies you should expect to have, or at least getting a postpartum x-ray if you're not sure, can be very helpful in keeping you out of this situation. So that's retained puppies. They can get very sick. They can rupture their uteruses. They can die. Those things all are real things that happen. If she has a retained placenta or metritis, which is an infection in the uterus different than pyometra, then that metritis is after having puppies. Pyometra is not being pregnant and having fluid and pus in your uterus. Different mechanisms, different progesterone levels, a few different things that happen, but either one's an infection in the uterus. So if we have a female that comes in and she's running a fever after she's had her puppies, it's likely going to be one of 2 things. It's likely either metritis, an infection in the uterus, or mastitis, an infection in the mammary glands. So we're going to look for the ultrasound. We're going to look for any signs of retained placenta, which we can see it kind of looks like an amoeba on the ultrasound. And she's typically going to be running a fever. If we find that to happen, then we're going to treat her with antibiotics, with probiotics, with oxytocin, and with, if oxytocin isn't working, then we're going to need to go with prostaglandins because oxytocin is only going to be effective for about 24 hours postpartum. After that, the uterus is no longer estrogen primed, so it's not as likely to respond to oxytocin. So at that point, we may have to go to something like prostaglandins, Lutalyse, or cloprostenol. Those are large animal drugs. And then surgery would be our last resort if we have to go in surgically. I have never had to take a metritis dog to surgery. I've had to take postpartum retained puppies to surgery, but never for a metritis. If you can manage these dogs adequately medically, that's superior. Why do probiotics work? Why are we talking about probiotics so much tonight? And that's because probiotics, we really strongly believe, reduce metritis, reduce mastitis, reduce diarrhea postpartum, reduce a whole bunch of things. So how do you pick a good one? Well, there's a ton of them on the market. First of all, you want to start with one that's made for dogs, because dogs don't have the same bacteria in their GI tracts that humans do. So we want to start with a dog one. Doc Roy's GI Symbiotics has a great track record of many, many years. Royal Canin's brand new one, the S. Boulardii, they have some great research behind it. If you email me, I'm happy to send you those articles. You can go to their website. This was started to be sold in January of this year, January of 2025 in the United States. So you should be able to find it on their website. And then, like I said, for the newborn puppies, the Nurture Flora can be very helpful. So probiotics can really significantly decrease some of these postpartum complications that we see. Next, we're going to talk about mastitis. What is mastitis? Mastitis is an infection of the mammary gland, the tissue that makes milk. Again, these females run a fever. They will have a change in the appearance of their milk. It may be bloody, it may be yellow, it may be green, it may be odd looking, but it's going to change. And then she's going to have one or more glands, mammary glands, that become very firm. And if it progresses without adequate medical intervention, those mammary glands may become infected to the point that they also lose their blood flow and they start to slough. So how do we prevent it? We use our probiotics. We use good hygiene, so we keep our whelping boxes clean. And I strongly recommend that 3 or 4 days before your bitch goes into labor that you give her a good bath. Clean her up well. It's going to reduce any chances of her having bacteria around her vulva, a number of bacteria in her mammary glands, anything that may cause her to have an infection. What if we do end up with mastitis? Well, treatment is going to be probiotics, because we're going to be putting her on an antibiotic, and that's going to help offset anything that would cause diarrhea. Cabbage leaves can be very soothing and very helpful for the dog. If she has mastitis, you just go to the grocery store and buy a head of cabbage and peel the leaves off one at a time. She should have IV or sub-Q fluids to keep her hydrated. You may need to use anti-inflammatories like Metacam, Meloxicam, or Carprofen, Rimadyl for the fever and the pain that she has. On rare occasion, these go to surgery. And I know a lot of veterinarians that say that if you start the female on antibiotics, you have to take the puppies off and hand raise them. I don't believe that that's necessarily the case. I think dogs should be very capable and very willing to still nurse their puppies, and it's absolutely safe. The amount of antibiotic that comes through in the milk is not anything to be concerned about. So I let puppies continue to nurse during mastitis. This is what mastitis can look like. This is a beagle. This is one of, obviously, 2 of her mammary glands that have become red and painful and swollen. This is what the mammary glands start to look like. That shiny white area is going to slough open, and I'm going to show you a series of slides. So if you're squeamish, look away. So this is what the tissue looked like the following day. So this was a series of photographs taken by one of my clients. You can see how the blood flow was lost in that area and how that's going to open up. And this is what it ends up looking like. So we can have some pretty significant changes to the mammary glands. The worst case scenario, and they don't happen often, fortunately, I've seen 2 or 3 of these, one every 10 years or so, is gangrenous mastitis. And that's when the mammary gland loses its blood flow altogether and it becomes black and really necrotic and shiny and nasty. And this one actually happened this past summer. My husband had a family reunion, and guess where I was? I was taking this dog to surgery. And again, if you're squeamish, look away, because this one's even worse. This is what the gland looked like when we had to take it off surgically. Now, the female within 24 hours was feeling a ton better and she recovered nicely. She lost one mammary gland. She'll still be able to nurse puppies next time, but you have to be really watchful of these, because these are very dangerous and these dogs can get sick enough to die. All right. Agalactia, another fairly common complication after having puppies. And what is agalactia? Agalactia is not the lack of galactic creatures, but a lack of lactation. So lactation is producing milk. So if she doesn't have enough milk, You may be able to notice right away that the mammary glands don't seem very full after she has the puppies or after the puppies nurse. The puppies may not be gaining weight adequately. And a rule of thumb, a really easy formula that you can calculate with a calculator, is that puppies should gain 2 to 4 grams per day per kilogram of anticipated adult body weight. So if you want to take a picture of this slide, it might be a good idea. You can keep track of this. And with this formula, typically a middle-sized dog, a Labrador, a Golden Retriever, should gain 1 to 2 pounds per week as the puppies grow. We used to say that puppies could lose up to 10% of their body weight and they would be okay. But now we know from NeoCare's information that if they lose more than 4% of their body weight, you're at risk of losing those puppies. So it's important that you intervene early if you have a female that's not producing adequate amounts of milk. And there are some things that you can do fairly effectively. One is we feed the females bratwurst. I know this sounds a little crazy. Fry it, don't boil it in beer and onions. So fry it, feed her the bratwurst, feed her the drippings off of the bratwurst mixed with her food. If it's a small dog, don't give a full bratwurst at a time. If it's a big dog, you can probably give 2 or 3 bratwursts a day. I don't know why bratwursts work, but they do. Other things you can do are feed oatmeal and sweet potatoes. That's what human lactation nurses make for recommendations. And then if you're having a difficult time getting her to eat, you can top dress her food with Royal Canin starter mousse, or you can mix this in with a bucket of water and improve her ability to drink because it tastes better. Drugs that we can use to aid lactation are going to be Oxymama. That's a nice product that we have over the counter. It has fenugreek and a number of other proprietary products in it that improve lactation. Metoclopramide, which is Reglan, that will help to produce milk, and then oxytocin helps to let the milk down. So all 3 of these can be used in combination with bratwurst, with oatmeal and sweet potatoes to help bring in the milk. If she's still not able to produce enough milk that your puppies are gaining at the rate that you think you should be, you can supplement feed with a bottle, or you can supplement feed with a feeding tube. Now, this little puppy is Miracle. She was one of my farm dog puppies that was born in 2024 and was not thriving, was not nursing. So she was handed off from my co-breeder to me to take to my house. And I do have an informational video that you can go to using this QR code so that you can very easily pop on and watch a tube feeding video. I've had more people tell me that this video has saved lives for them than any other video I've ever done. So keep this at hand in case you need it at 2 a.m. That's when you're going to need help. So this is a nice video. This is not on our website. We have some other videos that are, but this is little Miracle. She was very tiny when she was born, and her mother could not get her to nurse. So I took her to my house, and this is how to tube feed a puppy. Is I measure the tube from the tip of her nose to the end of her rib cage. And by doing that, I know I'm in the stomach. And then the second thing I'm going to do before I feed her is I'm going to pinch her toes or her tail and make sure that she can cry, that I can hear her squeak. There, you heard her. And by doing that, I know I'm in the esophagus and not in the airway. And then I'm going to very slowly feed her. I'm holding the tube with my left hand so that she doesn't move it outwards as she champs on the tube. That's normal for her to do that. And as she's champing, I don't want to move the tube out so that it slides out of position. And I'm just going to slowly then infuse the formula into her little tummy. And by doing this, we can very effectively help these puppies to start gaining weight. And once they start to gain, then they typically will take off and do very well on their own. So these are pictures of little Miracle. This is with her grafted mother. That's Helga. That was not her original mother. Lena's her mother. But Helga took her in. You can see how tiny she is compared to the other puppies that are 3 days different in age. But if you look at the picture way on the right-hand side, you can see that she turned out to be a normal-sized puppy. So she didn't end up to be teeny tiny. She ended up to be smaller than the average farm dog, but caught up with her brothers and did a very nice job gaining. So with a little supplement feeding, you can do a great job. The next thing is aggression of dogs toward people, toward their puppies, and toward other dogs. So treatment is going to consist of using a Thunder Ease collar or a pheromone collar to help calm her. Calcium can be very helpful as well. So we know again that calcium can definitely improve maternal skills and mothering. So if you have a female that seems a little bit growly about having puppies handled or about her puppies being able to nurse, make sure that you're doing something with that. The other thing that calcium does a great job of preventing is eclampsia. Now, eclampsia is when the dog's calcium levels drop too low. In cows, when their calciums drop low, they become flaccid and weak and they go down. In dogs, they look like they're having a seizure. This is an actual dog that had, you can see she's fairly small. She's a little chihuahua and she had 7 puppies nursing. And she came in looking like she was seizing. She was lateral. She couldn't stand. She was tremoring. Her temperature was high from the muscle tremors. And this is typically a large litter on a very small mama dog. So the only way to treat this is going to be with calcium. Now, if you start to see any signs of this, the dogs will start to walk in a real goose step stiff method. So if you start to see that, you want to start getting the oral calcium into her pretty quickly. And like I said, the injectable is faster than the gel is faster than the powder is faster than the tablets, and Tums are too slow. So make sure that you have your calcium on hand and you're preventing that. If she has a large litter, start giving calcium as soon as the puppies start nursing effectively. And then if they end up with advanced care, your vet is going to have to give calcium intravenously. But when she's hooked up to an EKG, it's pretty scary to give this. So you want to make sure that you're keeping ahead of this. The small dam with the oral calcium, the gels, or the powders can be very effectively kept from having this happen. Diarrhea, again, very common in dogs after they've had puppies. We see a lot of it from stress, from changing how much they're eating, from eating the placentas. If you're concerned about parasites, take a stool sample into your veterinarian. And again, we're going to want to do anything that avoids a diet change. We're going to want to use fenbendazole during the pregnancy so that we can reduce the risk of her having any parasites. And this is our typical protocol that we've been using for 20 years to prevent parasite migrations through the females and into their milk and into their puppies. So we can effectively prevent that. If you think you're having a problem with diarrhea, you can use kaolin and pectin. We do not recommend metronidazole during nursing because that can affect the puppy's development. Of course, probiotics and a bland diet can be helpful. Now, if you're going to do this, you want to make sure that you're not using the human kaopectate, which is now Pepto-Bismol product, and instead you're using the veterinary kaolin and pectin products. Very important that you do that. All right. Loss of appetite, again, is very common after the bitches have their puppies. They're busy with their puppies. They're very devoted to them. They don't want to go out to go potty. They don't want to leave them. They don't want to leave long enough to eat or to drink. So you have to keep ahead of this. Be strong, again, as an appetite stimulant. The Royal Canin Starter Mousse can be very helpful in getting the females to eat a little bit better. So keep a handle on that by adding those top dressing to the food. Next, we have SIPS, and SIPS is called subinvolution of placental sites. It is not sipping from a straw. Now, not many veterinarians are familiar with this, especially if they don't do a lot of reproduction. The symptoms are going to be a bright red, bloody vaginal discharge, bright red, mucousy, like bright red, not dark red, about 4 to 8 weeks after she has the puppies. She's too early to be back in heat. It is not an infection. It is not common, but if it happens, it can be fairly dramatic. I've seen it mostly in first-time females. They'll get up out of the whelping box, walk across the floor, and these big plops of blood come out, bright red blood. So if you see that, you probably want to go to your veterinary clinic, make sure that she's not anemic. If she becomes anemic, then it does need to be treated, but most dogs get over this themselves with either using megestrol acetate, which is a progestin, or prostaglandins. Again, these are going to be things that your veterinarian will be involved with treatment. And then anything else that can make a dog sick that's not pregnant or not postpartum can make a dog sick when she is postpartum. So if she's running a fever, if she's not feeling well, if she's got diarrhea, vomiting, anything, tick-borne disease, anything else can cause her. So anything that would normally cause a dog to get sick can make a postpartum dog get sick. So if she is ill, running a fever, not doing well, you have to kind of take a giant step back and say, okay, well, it could be mastitis, it could be metritis, it could be these other things, but what else could it be? So your veterinarian doesn't forget to look at the fact that anything else could make her sick. All right, so that's what we have for postpartum complications. We do have a lot of these articles in our learning center. We'll have the video up after it's edited, so that'll be available to you if you want to go back and watch it again. But this QR code will take you directly to our learning center where we have hundreds of articles and videos and webinars on breeding. So be sure you use that. Remember that we have 2 books. I have the book Canine Reproduction and Neonatology available through Revival Animal Health to help you with all of these complications. And don't forget that we do have our webinar coming up on December 10th, sending puppies to their new homes. So you can pop on there and join right now so that you get signed up for it. And then remember that we have all of our catalog available to you through this QR code, lots of the products that you need for raising your puppies. And then don't forget that we also have our pharmacy and auto ship. So you can save up to 5% on your auto ship if you want to have your prescriptions coming through Revival. Your veterinarian can get prescriptions to us and we can ship directly to that. And again, this is the code that Laura talked to you about at the beginning. It's EDU education, EDU 15, and it's $15 off a one-time use. So don't forget, we have our call center now open 7 days a week. In the picture is Kevin. He's one of our specialists for our rescue groups. So you do have access to the phone number and through the QR code. So be sure to place your orders. We also have bundles of products that are put together to kind of help you through some of your projects. Again, you can use the QR code, and these are less expensive ways to purchase products because we have bundled them together in groups, including whelping bundles.
Okay, Marty, we have tons of questions.
Yay!
Okay, so revival texts. What's this one?
This is how you can get texts from Revival on a daily basis so that you can keep up with all of our specials. It's very cool. I get it every day. Don't
Excellent.
forget we're on social media and Q&A. All right, Laura.
Here we are. We're to me. I jumped the gun just a tiny little bit because people are like all kinds of excited. We got questions, man.
Great.
Okay. Sandy Cuniff, thank you for joining us. Wants to know, is it normal for a mom after a C-section to not want to eat or drink and lack milk? I said absolutely, but you go.
Yes, for sure. But that's where some of these interventions can help. Metoclopramide can help bring in her milk. I don't think any female should have a C-section without going home on post-op pain medications. We've used meloxicam for 25 plus years. We've used carprofen. There are no studies that show that those products are safe, but I will tell you from firsthand experience, and we do hundreds of C-sections at our practice. And if you imagine hundreds of them a year for 25 years, we've had thousands of puppies raised on those products, and the females feel better, eat better, drink better, move better. Make sure she goes home on pain medication.
100%. Jennifer Demonte, thank you. Welcome, Jennifer. She asks, as a rescuer, we often save pregnant moms well into their pregnancies. Some shelters will vaccinate them upon intake and some won't while they're pregnant. What do you recommend doing if we take a stray that's pregnant? Which vaccines to give or not give?
Yes, and none of the vaccines are labeled to use during pregnancy. That's one of the challenges. And in a rescue situation, you are in a different place than we are when we are in a more controlled setting. So the general recommendation is to not vaccinate, but it depends on the risk factors in your shelter. If you're at risk of distemper, parvo, any of those things, then you almost have to. So that makes it a little bit more difficult. I'm at a dog show. Can you tell that my dogs are helping me in my hotel room today? So
Dog
use a vet-
webinar. It's okay, man.
avoid a modified live vaccine if you can. Ask your veterinarian if they can use a killed product or if they can split up the vaccine so that they're not giving as many at a time. So you need to kind of massage that theory a little bit on what works best for your shelter and what your risk factors are. You may be best off to try and keep your pregnant dogs in an isolated area so they're not in the general population, just because they're going to be better at being mothers anyway. So you may want to have to try to find foster homes to keep those dogs out of shelters.
100%. Okay, next up, Susan Sherwin wants to know, do you recommend the pregnancy diet for the entire term from breeding to whelping or about halfway through? I know, right? It's a great question. I wasn't going to
Yes.
answer it. I said 30-20 all the way through, but you speak to the
Yes.
42DT,
Yes,
but
30
RC.
30-20 is from the beginning until the
Yeah.
puppies are weaned. Puppies can eat it. Everybody can eat it. It's an all life stage diet. The HT42D, HT stands for heat. You feed it from the start of the heat cycle or when you want the heat cycle to start to the 42nd day of pregnancy. On day 43 is when you switch to mom and baby or a puppy diet. So that's a great question. And I did fly through that slide too quickly and overlooked that. I'm sorry.
It's okay. No, it was a great question. I knew you would know the answer, and I knew I'd get it wrong. I knew 30-20 because that's what I feed. Okay, Patricia Endell, welcome. Can you give a pregnant mom, you talked about raw food and what not to feed. She wants to know if you can give a pregnant mom freeze dried raw. I said maybe as a topper, but you speak to this.
Freeze-dried raw does not kill all of the bacteria and viruses. Take your
There you go.
chances. I would not recommend it.
There you go. Okay, so we do have some questions from our cat people. Elizabeth Miller is here, and she wants to know if some of the supplements you were talking about work for feline pregnancies. And I said, I don't know, cats.
Yeah, Laura's not the cat whisperer. Yes, most of them can be. The calcium is fine. The B strong is fine. I did not mention electrolytes, and I should have. There's a puppy light and a kitten light, which are electrolyte solutions that can help if you have a female that's not drinking enough or that may have diarrhea. The feline is obviously the kitten light, and the canine is puppy light, but they're pretty much the same product, so they're interchangeable. So almost all of these products can be used for cats, and most of them do have a cat label. If you go to our website under the product details, you can find that information. But yes, calcium is safe, and yes, Be Strong is safe, and yes, the Nurture Flora is safe.
Okay, beautiful. Anonymous. There's okay, so that was something about something else. Sandy, kind of back to the HT42D. If you're feeding that, do you still want to use the supplements?
Well, you mean like folic acid? If you have a brachycephalic, I would still add folic acid to that.
That's
If
what
you
I
have a line of,
said.
yeah, or if you have a line of dogs that's got a history of cleft palates or other midline defects, yes. As a general rule, if you have, your garden variety Labrador, Golden Retriever, Great Dane, most of those dogs don't need any folic acid supplement, but the brachycephalics, I don't think you're going to really overdo folic acid. I mean, there's only one published dose, which is 5 milligrams per dog per day. Most people don't feed that much, but if you have a brachycephalic, you have Frenchies or Boston Terriers or Bulldogs or any of those breeds, just give them folic acid. The worst thing that happens is you give them expensive urine and they urinate out the extra B vitamins. It doesn't cause any harm other than to your checking account.
I said folic acid and probiotics. Like I give
Yeah,
that to everybody no matter
yeah,
what, because
exactly. It's pretty safe.
just saying. Okie dokie. Sandy had another question. Sandy, kind of, if a female has had a C-section, and I'm not entirely sure what she means by this, but an open at the rear, as the puppy could not be pulled forward, is it safe for her to have another litter?
I'm assuming she means an episiotomy, where they opened up the vaginal vault a little bit bigger. It depends on what the problem was. If this was an extraordinarily large puppy and she's likely to have a normal sized puppy in her next litter, you probably don't need another C-section. However, if she had an average sized puppy, and I don't know what breed she's talking about, so a Golden Retriever typically has a 16-ounce puppy, a Jack Russell Terrier typically has a 6-ounce puppy. It depends a lot on what breed you have and how that puppy was. Was it malformed? Was it an Anasarca puppy? Was there something unusual about that puppy that caused the issue? Then she probably doesn't need another C-section. But 75% of C-sections are maternal in origin, 25% are fetal. So that means that 25% of the time the puppy was too big or malpositioned, 75% of the time it was the female. And if she's a bulldog and she had a C-section, she's still a bulldog after her C-section. She didn't change breeds. So likely you will need another C-section because whatever happened will possibly happen again. Now I've seen puppies come down the uterine horn. They're supposed to come down each horn and then come out the vaginal vault. Sometimes a puppy comes down, takes a wrong turn, goes this direction and doesn't
Wrong
come
way,
out.
Corrigan.
Exactly. Sometimes you'll have other issues that happen with the shoulder coming first or something happening. So it's going to depend on what happened. I can't really tell you without a little more detail, but if you email me, I'm happy to talk to you.
Okay. we do have a bunch more questions in the ones that already were asked and a bunch more in the open questions. So this could be a minute. Let's see. Donna, hi Donna Baker Austin. Would you suggest giving all newborns the Nurture Flora from birth to what age?
From birth till about 2 weeks, I would give it to everybody to get them all off to a good start. If you get the right bacterial flora in their gut, they're going to start off healthier, happier, less parasites, less diarrhea, less problems with not gaining weight adequately. So, yeah, just start them off right. It's a lovely little, it's kind of a funny color. It's kind of a brownish color, but you put a little dab on their tongue, and boy, I'll tell you, it gets them off to a great start.
All about it. Okay, Elizabeth Miller would like to know which supplements can we give to mama kitties to improve their lactation?
You can use Reglan, metoclopramide. You can use Oxymama. Bratwurst are going to be a little bit of a harder sell.
I,
Um,
I didn't know about the bratwurst for the kitties, man.
Yeah, you can try grinding it up a little bit, but if you throw a whole brat in her bowl, I'm pretty sure she's not going to eat it. So yeah, try a smaller amount of some sausage if she's a good little eater. I
Cut
don't
it up in little baby kitty sizes.
exactly, run it through your blender, make it into a soup, brat soup. We have brat soup in Wisconsin. It's usually, you know,
Or beer cheese soup, but that's
oh yeah,
not the
that
same.
too.
Okay, not that. Okay. Anonymous says what happens, y'all, when we get Marty and I going. Anonymous would like to know how much is too much calcium. I'm like, right? So you say.
Well,
She asks, or Anonymous asks, that they were told that you can trigger eclampsia by overdosing calcium. And I believe that's wrong, but you tell me.
eclampsia will happen if you give calcium too early in the pregnancy. If you
Right.
don't wait until she's in labor and then start your calcium, yes, you can cause eclampsia because you basically tell her parathyroid gland, you can go on vacation. You don't need to do this. So you don't want to start your calcium during the pregnancy. You want to start it at the onset of labor. How much calcium is too much? Well, a typical 50 or 60-pound dog can take 500 milligrams or 600 milligrams, two of those twice a day, and not overdose on it. The GI tract is pretty forgiving and it will not allow too much calcium to be absorbed. Now, that being said, you don't want to give her a handful of Tums, but 500 to 1200 milligrams twice a day would be for an average sized dog dose. Small dogs less, big dogs more.
Got it. Okay. I know that there is a poll that's going to be dropping soon from Revival. But we're not quite there yet. So y'all don't leave. Don't leave. There's a poll coming. We want your input. So we still have more questions. This might run a little long because we have lots of questions. Sandy Cutoff again. Can our vaccinations be sent to Canada?
I don't think we can cross biologicals over country lines. I'm not sure, but the Breeders' Cupboard in Canada does carry our Revival product, so I would have to check with how customs is currently handling those things, but I don't think we can cross vaccines. There's concerns with avian influenza and a bunch of stuff, so we have to be careful.
Okay. And so you mentioned this, but I've got the question, so I'm going to ask you to reiterate it. What pain medications do you prefer for post-op pain management after a C-section that's safe for nursing puppies? So everybody, hear the question. I know Marty covered it, but here we're going to learn
Okay.
some more.
We went over it pretty
Learn
fast.
it again.
So meloxicam, Metacam, Mobec, that's all one drug. So that's meloxicam is the active ingredient. There's a couple of different names for it. Comes as a liquid and as a tablet. Rimadyl or Carprofen. Rimadyl is the Zoetis product. Carprofen is the generic product. Both of those have been used very extensively and very safely for postpartum bitches. I know there's a lot of people who use Tramadol or Trazodone and some of the others, gabapentin. My concern with those drugs is that they may make the female drowsy. It may change her mental status and make her less inhibited and more likely to snark at her puppies. So I don't use those. I use calcium. I use the Adaptil or the Thunderease collar. I use Rimadyl or Metacam, and I save placental fluid at the C-section to send home with people to put on their babies, because when they go home, they smell like laundry soap from the towels that clinic used. And if we send home that in a little bottle, some people send home placentas, those are kind of messy. So I just save some of the fluid. Now, remember, it doesn't have preservatives in it, so you need to refrigerate it. Comes out of the mom, does not have preservatives. So I use a lot of that, and I will tell you, it's like a flip switch. You put that on the puppy's head and on the puppy's rear end, and the bitch goes from, what is that alien creature, to, oh, that's my baby.
Super important. Okay. One of our attendees wants to learn more about SIPs. Can you, I'm gonna drop in the chat here. Everybody who's interested, Marty, what is your email address where someone could email you and ask you more information about SIPs?
They can email me either through Revival, or you can go to VV, so that's Veterinary Village, at the letter K, the number 9, the word stork.com. If you send it to me, I'm highly irresponsible and not very good at responding to emails.
Can attest to this. Can confirm.
And it's not on purpose. It's fine. It's just
that even
function.
I cannot get a hold of her half the time. So y'all send it to the vet clinic where somebody will like make sure
Yeah.
they beat upon her until she answers.
Yes, Holly that actually runs my life.
Okay, there you go. Susan Smith wants to know if you can give Oxymama a few days before delivery is expected.
Yes, especially if you have a dog or a line of dogs that don't lactate well. Yes. You don't want to have her use all her colostrum up before. So if she's already coming into milk pretty well, don't give it. But if you're, because I've got a line of corgis, they do not produce milk well. Yes. In those lines of dogs, you can start at 2 to 3 days ahead of time.
Okay, great. And then Heidi, I think we may have answered this question. Heidi Pack wants to know, in order to prevent eclampsia, should we be giving new moms calcium daily, Oral Cal Plus? If so, is there concern with giving too much calcium? We talked about this. The most important part, right, Marty, is to not give calcium before the first puppy is born.
Well, as soon as she kicks into labor, like if she's in labor at 10 o'clock at night, you can start it, but you don't want to start it 3 days ahead of time. So start it when she starts showing signs of labor. And I will tell you, the powder, it mixes in really well with the food. You can sprinkle it over the kibble. When I was being interviewed for the job at Revival, they sent me a jar of their newly formulated calcium, and they called me and they said, well, what did you think of it? And I said, it tastes really good. And they said, what? I said, yeah, it tastes like vanilla. They go, you put your finger in that and tasted it? I'm like, absolutely.
It's Marty, because of course she's going to stick her tongue in it.
Of course. Like, why wouldn't you taste it and find out? Yeah, it tastes yummy. The dogs will take it very readily. The Be Strong tastes good. I mean, most of our formulas, I'll tell you, the Oral Cal Plus, the gel, there's another product that's a gel product on the market that's really astringent and it's nasty in their mouths. But the Oral Cal gel that we carry at Revival is highly palatable. So, there's some magic that went on when those were developed.
Okay, beautiful. The questions are just keep multiplying.
We're not getting anywhere.
Nope, we are not making any progress. They're just keep adding more questions. You all, thank you. Good job on the questions. This is fantastic. Anonymous would like to know if you prefer feeding Purina Performance or Royal Canin Pregnancy Diet over feeding the dam a puppy formula diet during pregnancy and nursing.
Yes. There are
Yes.
some very strong reasons to feed the HT42D, and it is formulated for pregnancy in a way that no other diet on the market is. And that's what I feed my dogs when I'm breeding them.
Can you give, Patricia Andel would like to know if you can give a pregnant mom heartworm medicine.
You can. The only one that's not labeled for safe use during pregnancy is Trifexis. even the ProHeart 12 injectable can be given during pregnancy. Now, I usually try to avoid it in the first 3 weeks of the pregnancy just because that's the first trimester. But
Mhm.
if you give it before you breed her and then 4 weeks later, that avoids that first 3 week period. So, yes, all except for trifexis are labeled as safe during pregnancy.
Okay, perfect. Naomi Beam would like to know what age you recommend weaning puppies.
Well, it depends on the breed. My
Mhm.
corgi bitches at 3 weeks of age, they will say, "You have teeth and you are evil and you need to start eating on your own. Bye bye." They
Wire hair
walk in,
puppies, same,
yep,
same.
yep, they walk in the box, they count the puppies, they step back out, they're like, "I'm done." My
Easy.
farm dog females will nurse their puppies until they're 8 weeks old and they're out in the yard vomiting for the puppies because they love their puppies so much they don't want to wean them. So it depends. If you have a Cavalier, they're probably going to nurse until they're like 12 years old. If
Spinoni.
Yeah, if they're other breeds, so as it depends on the breed, it depends on how much milk they have, it depends on how well they'll eat. Typically around 3 to 6 weeks is where we start weaning, but it depends.
Excellent. Nancy Junker has a great question I have not seen before. Do you ever find utility in a compounded oxytocin nasal spray postpartum to help
So
bonding if there seems to be difficulties?
yes, and you don't even have to have it compounded. At least until recently, you could buy it over the counter.
Mhm.
I think it's pretty interesting, but I've never seen a study. Have I sent it home with females that have not been great mothers? Yes. Have I seen a study on it? No. Will it cause any harm? No. Just you just got to write a check for it. So if you want to try it, go for it. There's no harm.
Okay, great. Lynn Sell would like to know if you're still recommending DHA during pregnancy and nursing.
Oh, yeah. And we didn't do this as a pregnancy exclusive webinar, but Lynn, I know Lynn has had firsthand experience with this
Mm-hmm.
because she's one of my friends and one of my clients. So, yes, we are still recommending using DHA. It improves eye development and brain development of the puppies to the point that you may have puppies that are way smarter than you want them to be. But yes, and we know from studies done at Canine Companions for Independence, yes, if you don't want smart puppies, don't give it. Canine Companions for Independence did a study of 5,900 puppies. That's 6,000 puppies that they were able to study their graduation rates for Canine Companions for Independence. And the bitches, by the time they got to their fifth litter, their DHA levels were low. They looked at 200 nutrients. Russ Kelly did this research.
Mm-hmm.
That the older the bitch and the more litter she had, the lower their DHA levels were, and the less likely the puppies were to
Oh,
graduate
that's really interesting.
from their service dog program. So yes, Lynn, absolutely, I have not changed that, but it's just this wasn't an entirely focused pregnancy. It was more on postpartum, so I didn't really get a
Mhm.
chance to cover that.
Yep. Okay. Quick question from Jan King. Is it safe to feed pregnant dogs raw eggs?
It's not safe to feed any dog raw eggs. A, we have avian influenza. B, if they eat raw eggs too frequently, they will end up with a biotin. That's a B vitamin deficiency. So eggs are lovely. They're a great protein source. Cook them.
Cooking is a thing. Oh my goodness. Okay. We're still going, guys. We got more questions. We love it. We are so happy you guys are here and engaged. Thank you so much for joining us. Anonymous wants to know if you recommend continuing a DM's joint supplements during pregnancy, such as Desican.
Yes.
Okay. Excellent. Yes. Brenda Belmonte. Hello, Brenda. Um, came in to beat the slide raw or cooked. Cooked. Litter of tollers due on Tuesday. Whoop whoop. Cheryl Sides. Oh boy, this is a big one. Cheryl Sides wants to know, Marty, what causes open fontanelles in puppies?
Partly genetics and partly midline defects. So again, your folic acid is important for any midline defect. That's umbilical hernia, that's open abdominal wall, that's cleft palate, that's cleft lip, that's open fontanelle. Anything down the middle of you where your right side and your left side were supposed to find each other embryologically and they missed. Oops. There is a folic acid felt to be implicated in that. So again, you can't really hurt them with up to 5 milligrams a day of folic acid.
Beautiful. Anonymous. So we've got a couple questions here in a row. So I'm just going to skip to this one because I think it's pretty quick. I may have missed this answer, but how many days after C-section can you use NSAIDs?
I use them for 3 days. Most of the time, that's sufficient. If you
Okay.
have a sensitive bitch and she needs it longer, then you can go 5 to 7.
Okay. This is a bigger question. That's why I skipped it for a minute. Naomi Beam would like to know, is there a way to test when my bitch will go into heat?
Nope.
Nope.
She's a
Do you make
bitch.
short work out of that?
She comes in when she wants to.
When she's good and ready. I'm saying.
If you're having trouble with it, you can put them on the appropriate diet. We talked about HT, 42D, and Purina Sport 3020, and Be Strong. And many times that will bring them into heat, but there are no guarantees. Bitches are bitches.
They are indeed that. Kathleen Jetland says that she's had some allergy issues with her Royal Canin dog food. She wants to know if these issues with the RC42 are the same, or does the benefit outweigh the risk, or should she look at another option?
That's a really complicated question. We have to have a direct conversation. I can't give you a short answer on that.
Okay. So Kathleen, we dropped the email in the chat. You should click that link that we dropped and email Marty, and she will help you with that. Nancy Junker, this is a good one. What combo heartworm flea tick products can or cannot be used when about to breed, breeding, or pregnant?
There is no combo heartworm, flea, and tick product that's safe or labeled as safe for pregnancy. So Credelio Simparica and NexGard do not have a product that's tested as safe during pregnancy. Bravecto is the only oral flea and tick product that we have that's tested safe.
Beautiful. Jennifer DeMonte, that probably answered your question, although you have a specific add-on. She's working with some rescue dogs, Marty. And she wants to know, is Capstar okay to use if the pregnant mom has visible fleas?
I'm going to have to go back and look at my chart. I have a whole chart I can email you. And you can also use Dr. Greer at revivalanimal.com if you want to send me an email directly to Revival. I have a chart that Lori Sheehan, the pharmacist, and I put together that will outline every single flea and tick and every single heartworm product on the market and what's safe, what age, what size, and what's safe during pregnancy and for breeding.
Okay, beautiful. Jennifer, shoot Marnie an email. She'll get you that information. A quick little insertion. Revival would like to know about the time that we're doing these webinars. There's going to be a poll dropped. Please stick around to answer the poll.
There it is.
Super important. Here's your poll. Please answer this question. This is really important to us. We're very much interested in making this serviceable to you, right? Like, this is our goal. We don't want this to go until 8:15 at night if you guys don't want to do it. Okay, so please answer this quick webinar time preference poll. Meanwhile, we have one final question. One's a thank you. You're welcome, Christy.
Oh, good.
Anonymous wants to know, while we're all filling out our poll, please, back to the DHA. How much DHA?
There's not a published dose that I'm aware of. So typically I look at what the label says for an adult human, and then I grade it from there. So if you have a 60-pound dog, you're going to give probably half of an adult dose. If you have a 20-pound dog, I would give a child's dose or 1/4 of an adult dose. But that's the best information we have. I don't think that CCI, when they published their data with Russ Kelly, that they actually gave specifics on the amount. But do what's reasonable and be sure you're not using something with too much vitamin A, because vitamin A can cause midline defects. And cod liver oil, for instance, is a very high vitamin A product. Fish oil in general is safer than like cod liver oil. So just, be careful. And if you have any questions, again, send me an email and I'll give you some input on that. So
Alright.
we just need to know if afternoon, we've always historically done these at 1 in the afternoon, Central Time.
This
we're
is
looking to
not 1
see-
in the afternoon, dude.
No, that's what we're looking to see is there interest in the evenings or is there interest in the daytime?
We like the evenings. Everybody's here. We had literally 34. Let's see. I got to do math on the fly. 47 questions and comments.
That's a lot.
So I feel like we're doing pretty well. Well over 100 people joining us. I love this. I think it's fantastic. I know I don't get to vote, but whoop whoop.
No.
Way to go, Revival. Okay. Everybody, please, 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 please fill out your poll. Marty, thank you as always. Your insight, your time, your dedication, your passion. Like we are not worthy. We are not worthy.
Oh, I love doing this. So thanks for everybody for joining us tonight.
Thanks so much. Peace, yo.
Recording stopped.